Okay, we're going to get started. We've got a full program for you all today, so we'll get started as people still come in. Like I said, my name is Caitlin Forbes, and I work with the National Institute for Children's Health Quality, NICHQ as we refer to ourselves. We're a national nonprofit focused on achieving better health outcomes for children and families. I appreciate everyone joining us, and I hope you're all staying safe and well during these unprecedented times. I want to thank you in advance for your patience in case we run into any technology challenges. We're hosting this webinar from our homes rather than our office. NICHQ is honored to be hosting this webinar on behalf of Baby First Network. A quick disclosure that the webinar content you will view today is entirely their own. However, we hope that you'll see that it very much aligns with NICHQ's mission, and we are really thrilled that we get to support their work today. I'm now pleased to introduce Dr. Stacy D. Scott, who is a Senior Project Director at NICHQ and the Executive Director of Baby First Network. Scott is a 30-year public health advocate and infant safe sleep expert with work ranging from the government agency level to ground zero. She has spearheaded numerous community outreach programs nationwide to end health disparities and reduce the risk of sudden unexpected infant deaths. She founded the Global Infant Safe Sleep Center in 2016, an organization with a mission to support vulnerable and marginalized communities to reduce sudden unexpected infant death. I will now turn it over to Dr. Scott to lead this important webinar.
Thank you, Caitlin. And thank you, all of you, for joining us today. I really would like to thank NICHQ for providing a platform to help bring awareness to this subject matter and all the subject matters that impact vulnerable communities. In many cases, some subject matters may not be deemed a priority for many, but may be a matter of life and death for a few. Although this is a difficult time, we are facing the challenges of COVID-19 pandemic and the added stresses that is brought upon us. There are certain groups in this country experiencing an extra layer of stress, frustration, even death, because of the inequalities and equities that face in their daily lives. Data, although limited and mostly from just a few states, show COVID-19 having a disproportionate impact on the communities of color. Communities that may already be challenged with high infant mortality rates. The purpose of this webinar is to pay homage to Black mothers and families, particularly those who have and will experience an infant death. Today, we're going to talk about the social determinants of grief and the impact on Black infant loss. Next slide. So I believe it's important to take a moment to reflect on the impact of COVID-19 is having on us economically, politically, socially, and how it's impacting our education and our health systems, employment, and even the ways many worship. We are a country, a world, in a new form of collective mourning. We are experiencing a traumatic event that is occurring in our neighborhoods, our communities, our cities, and our states. Next slide. So when we look at health, and we know health starts in our homes, our schools, our workplaces and neighborhoods, our communities, we know that taking care of ourselves by eating well and staying alive, not smoking, getting the recommended immunizations and screening tests, and seeing a doctor when we're sick. This all influences our health. Our health is also determined in part by access to social and economic opportunities, the resources and supports available in our homes, neighborhood, and communities, the quality of our schooling, the safety of our workplaces, the cleanliness of our water and food and air, and the nature of our social interactions and relationships. We recognize that all Americans deserve an equal opportunity to make the choices to lead to good health. But unfortunately, for many, that is not the case. Next slide. So, you may agree with me, or you may not, and it's okay. But I consider COVID-19 our newest determinant. We are seeing how social injustice and implicit bias has impacted the vulnerable in being, when it comes to both being tested and being treated. And although COVID-19 is contributing to the disparity of death toll, one cannot dismiss the impact of racism and discrimination that has plagued people of color throughout history, be they Black, brown, red, or yellow. Next slide. Make no mistake, COVID-19 is not causing the disparities. It is the things that we see that have existed and continue it to perpetuate, which, as you see here on the screen, talks about the unemployment and food insecurity and unstable and substandard housing. Again, we know that these things really play havoc in communities of low income and communities of color. Next slide. So to talk a little bit about today, and again, who is Baby First Network and why we felt that this webinar was important. Because of the work that Baby First Network does, we actually see deaths in real time. We value the importance of helping underserved populations recognize that persistent consuming grief may increase the risk of depression, substance abuse, suicide, serious health issues such as heart problems and high blood pressure and cancer. We are working to address factors that may impede an individual's ability to seek out support services for such reasons as racism, economic disadvantage, social class, religious diversity. The goal of the webinar is to build awareness and to encourage the utilization of support services to families that are impacted disproportionately by the loss of an infant. Next slide. So again, Baby First Network is a nonprofit organization that's actually located in Toledo, Ohio. It's dedicated to supporting families who have lost children from sudden unexpected infant death. The organization's evolution began nearly 40 years ago with 5 localized support groups that were ran by parents. It's spread out throughout Ohio, through all the major cities, both rural areas as well as looking at urban. And under all of this national umbrella, they were really working under, at that particular time, the National Sudden Infant Death Syndrome Foundation. For many of you all know that has evolved into the organization First Candle. The mission was and remains today to improve the knowledge and skills of those who are interact with SIDS and other infant death families, and to increase public awareness and knowledge regarding sudden unexpected infant deaths. Move to the next slide, please. And here's our webpage. We are charged with providing law support. We do a lot of in-services to professionals, and we work hard to provide community outreach services. Next slide. So, again, this is not about Ohio, but I just want to frame it on how Baby First Network has gotten into this arena, and really want to talk about the work that we have done, and then move on looking at it from a national perspective. So in Ohio in 2018, Ohio's infant mortality rate decreased at an average of 1.1%. And after 5 years increase, the Black infant mortality rate went from 15.6 to 1,000 births in 2017, down to 13.9 in 2018. And this is something truly to celebrate. However, still, Black infants died at a rate of 2.5 to 3 times higher than white infants. So the question for us was, with all of these babies dying, and with all of us working so hard to reduce the disparities, in the meantime, who was helping these families get through their losses? Next slide. Next slide, please. So, talking about Ohio and some of the laws that they have on the books, the Ohio may be somewhat unique that in 2002, in the response to needs created by the occurrence of SIDS and other infant deaths, the Ohio Department of Health created the Sudden Infant Death Syndrome Program. It's funded by the Maternal and Child Health Block Grant for the purpose to ensure compliance with a mandate, a part of the Ohio Revised Code 313-121, which is related to reporting sudden unexpected infant deaths and the provision of supporting bereavement services. An ongoing program, which Baby First Network works closely with the Ohio Department of Health, the Ohio Coroners Association, and the local health departments to ensure appropriate service providers are alerted when there has been a sudden infant death in a community. Next slide. So how does the process work? That what we see is that within 72 hours of the notification of death that is sent from a coroner's office to Baby First Network, and after we collect pertinent information, we actually send letters to parents, we provide information to them about available resources, and then we also explain what the process is. With that, we send a referral to the local health department where the family resides in their county, and then a public health nurse contacts the family in an effort to conduct a bereavement home visit. I know this is unique probably compared to other states, but again, this is a service that we provide. It's a great service that we are able to provide support to parents who have lost children suddenly and unexpectedly. Next slide. So for many of you who are on this call who may not be familiar with some of those terms, I just wanted to let you know that when we talk about sudden infant death syndrome, and we talk about sudden unexpected infant death, which is really kind of the umbrella term that encompasses what we refer to as SIDS, which is a medical cause of death, a sudden death of an infant less than 1 year that remains unexplained after an investigation, including an autopsy, death scene investigation, and review of health history. Next slide. In addition, it also covers sleep-related deaths, and these are deaths of infants while sleeping, characteristics of these elements, and really is in sleep environment, which really appears to play a role in sudden unexpected infant death, again, including SIDS, asphyxia, and some undetermined causes. Next slide. So when we look at the national disparities, we see that in 2017, more than a third of infants were tied to preterm birth when a baby was born before 37 weeks of pregnancy. And while the preterm birth rate has fallen in recent years, it has rose between 2015 and 2017 for African American women who are more likely to give a preterm birth. According to the report that is done by CDC, babies born to Black women were more than 3 times as likely to die of preterm birth related to issues as babies were born to white women in 2017. Note, babies who survive preterm birth can face problems with breathing and hearing or seeing, as well as development delays and long-term health issues. This chart shows the impact of infant death by race. Next slide, please. So I want to just kind of go into a little bit about the stages of grief and possibly look at what our new normal may encompass for us going forward. Next slide. So I know many of you who are doing bereavement support are very familiar with these grief cycles. Again, denial, anger, depression, bargaining, and acceptance. And for some, there even is a 6th stage, which is really returning to meaningful life employment, security, self-esteem, and really addressing what the true meaning of life is all about. Next slide. So what will be the new normal? And again, I cannot ignore COVID-19 and the impact that it's having. Just in recent days, I have begun to look at and read about funeral professionals and religious leaders that have to weigh on families' needs to mourn against the community's safety and pretension of legal consequences of violating state orders. We're seeing loved ones are being denied access to hospitals and care centers that are not able to say goodbye or accept the illness. We see loved ones stored in climate-controlled trucks as temporary morgues for days. And we're also seeing a prolonged stage 1 shock and denial in the stages of grief. So it really concerns me as we look at going through this process and stages of grief, how would that impact all of us, not only emotionally, but again, from our mental well-being. Next slide. So, understanding African-American grief. I have to admit, this was a very tough subject for me. As I began to research, I was shocked on how little information there was out there. All my life, I've seen the devastating impact of premature death of families and friends. I sit through and have sat through too many funerals knowing that had certain interventions been in place, this person may have still been alive. I've heard the many rationalizations such as, she's in a better place, he suffers no more, as a means to deal with all the inequities that may have caused us being there in that position of mourning at that time. Next slide. Understanding African-American grief, we must take a long look at the historical and contemporary experiences around the issues of death. We must recognize the troubling fact that there is very little research on Black grief and its connection to racism and social injustice. Next slide. Even looking at evidence-based and evidence-informed, and for us who work in public health, we are really wedded about evidence-based outcomes and being able to prove that there's some differences being made. But unfortunately, what we see is that African Americans make up 13% of the population, and out of the thousands of studies on grief, only 31 published papers are focused exclusively on African American experiences of loss. And this was as of 2016. Next slide. So why the neglect of African American grief? One may think about it as that many who write about grief may assume that African American grief is no different than the general population. And as this author said, the Euro-American grief. African American grief may be aversive for some whites to study because understanding African American grief could draw whites into understanding the pain and the premature deaths caused by white oppression and the indifference to that oppression. Next slide. So if we look at it from a historical perspective, here you see the continuum starting from 1619 when slavery began, and begin to look at really the experience of African Americans and how the loss and trauma has been compounded throughout this continuum for 400 years. You have heard in the last year, as we talked about celebrating the 400 years since slavery began. And so you can see here, we've moved from slavery to emancipation, to Jim Crow laws and segregations, to civil rights, and from 1970 to present day. and even now dealing with the crises that we see that are plaguing our community as I speak. Next slide. So according to the articles of African American parents following prenatal and pediatric death, a literature review, which I again found and thought this was very interesting and wanted to share with you today, just some pieces around it. And really what they did is they looked at several publications, but for the purpose of this, they really reviewed 10 of them and really talked about the grief responses, outcomes, and the implications of African American parents who experienced the death of a child. Next slide. And so with that, there were 4 themes: emotional response to loss, factors that added to the burden of loss, coping strategies, and health consequences of grief. Next slide. And so I wanted to pay close attention to this health consequences of grief. And there were 2 different perspectives that we saw from researchers. And one study found that no association between the level of grief and the perception of general health. And what that really meant was that women did not define their health based on mental health, but solely on physical health. And so when you go down to the second one, it talks about another study where the better mothers perceived their health, the better mothers felt that they felt okay, they began to see that there was a higher level of depression. And one of the reasons they feel that this kind of wrung out from this study is that they felt that African Americans may feel that mental illness is a sign of weakness. So as a part of that, we see that many people consequently, really African Americans, denied needing professional support. Next slide. So I am coming from a term that I've been down so long that down don't bother me. And that is a term that I've heard throughout my youth and growing up in regards to, again, the mental state, the depression, the grief and mourning that we see in many cases in African American communities. Next slide. So when we talk about this whole thing of strength, I just thought I'd share this, and I'm doing this because I really wanted to give you all some resources because they are so limited that might be able to help you as you begin to or continue to work with this particular population. While both Black men and women identities have been bound by culture mandates to be strong, we see that the manifestation of strength that has become normative for Black women is uniquely racialized and gendered. Again, this is a direct quote from the book. And so what we see that when we talk about strong as a racial gender code word, it is the verbal and mental shorthand of 3 core features that strong Black women really carry. And that is being a great caregiver, to be independent, to be and have emotional strength, and be able to really keep it in the middle of the road despite what other obstacles that might come against you. Next slide. So when we see this, and you see here who is these strong Black women, and you might notice that the spaces are omitted, and that's intentional. The scrunching of the word is meant to emphasize the distinguishing between being a Black woman who is strong versus being a strong Black woman. These are strong women and men in all, they are actually strong men and women in all racial and ethnic groups, individuals who possess a multiplicity of spiritual, emotional, and physical fortitudes that sustain them through tough crises and through journeys of struggle. However, The strong Black women, in contrast, is a particular, it's fixed, it's a way of being in the world. Again, it is a racialized gender performance, a scriptive role into which Black women are socialized, usually beginning in childhood. Rather being a genuine expression of their personality, it's a mask that stifles their authenticity, resulting in self-sacrificing and emotional stoicism. And I can definitely attest to that, being African American and watching my mother when my father passed away, and how the speech she gave when we left to go to the funeral is to say, you just need to be strong. And I can remember one of my relatives who just broke down, who within the funeral basically begged my mother for forgiveness for not being able to be stoic and that strong woman that my mother projected. So this is real. And so when we talk about, again, who are these women? They come from diverse backgrounds. They're all ages. They can be students at a HBCU, which is a historical Black college and university, to Ivy League schools. They can be minimum wage workers who struggle to make ends meet. They can be corporate employees, management level positions. They can be married, single, with or without children. And despite the great social economic diversity, they are similar in many respects. Regardless of their station in life, each has a high sense of responsibility and consequently serve as load barriers. Next slide. So now looking at what social determinants of grief. And again, please know we are looking at this from that lens of that strong Black woman. And we see that they constantly extend themselves to others. They're driven by deeply ingrained desires to be seen as helpful and caring. They're incapable of saying no to requests without experiencing feelings of guilt and worthlessness. They're incapable of asking for help, as she says, as capable as she is of saying no. Since childhood, she has been taught that a good Black woman is independent, a giver of help, including emotional, financial, and instrumental support. They deal with stressful life events. They're impacted by racism. They receive unfair treatment, and they experience other serious illnesses and or untimely deaths. Next slide. Next slide. So that strength, that being that strong Black woman can be dangerous. Black women who are strong may be commendable, but being a strong Black woman, again, as I said, is dangerous. It's a mythological strength of Black women often masks the very real vulnerabilities of their lives. They are largely ignored. A health crisis, which are confronting women, Black women in America. It's amazing that even when Black women seek out mental health, in many cases, therapists say, well, I can't see anything wrong because of the fact of the strength that many of us portray as we go in, even trying to seek out help. And during and since slavery, then the strength of Black women has been a backhanded compliment, a convenient rationalization for the oppressive circumstances under which Black women live and labor. So I strongly encourage to, again, get that book. It gives you a whole lot more feedback, but this is some great passages that we were able to pull from that. Next slide. So, in looking at infant loss, we are really, again, exploring some of the impacts that we see in with living with these types of losses. So go ahead to the next slide, please. So, looking at perinatal loss in low-income African-American families, This was a study that was conducted in Detroit, Michigan. It actually examined the experience of low-income African-American parents surrounding perinatal loss and described how other life stressors influenced parents' responses and carings of needs. Can you go to the next slide, please? So, out of those 4 themes that emerged: recognizing problems and responding to loss, dealing with stressful life events, creating and cherishing memories of their infants, and living with the loss. Next slide. So I actually pulled some of the direct quotes from the article and the lived experiences, and I won't read them all, but I wanted you all to be able to understand and hear the words of parents who had experienced these losses. One of the first things that they saw was really misreading symptoms of pregnancies and complications. We saw that parents experienced intense feelings surrounding their loss and were often unprepared for the baby's death, even in those situations when mothers had experienced serious problems during their pregnancy. Here's a quote from a father who said, "Not even with the water being broken, I guess for a week prior, we thought the baby was just sitting on her bladder and that she had no control of that. But that's the kind of stuff that comes with being a first-time parent and really not knowing what's happened." Next slide. The other piece was maintaining hope during medical treatment. And although parents had experienced prenatal complications, they maintained hope for their infants. Even those parents who were told on their infant's death in utero were hoping that there would be a miracle. They would hear their baby's cries at the time of birth. One mother recalled, "I heard her. I kissed her. I was just praying for a miracle. Please open your eyes. Please open your eyes." Parents also were hopeful because of their expectations of aggressive treatment for their infants. They were familiar with advances that had been made in prenatal care through their own prior experiences. Those family members also talked about how these things were publicized in the media. One parent even made a comparison to knowing people who had been shot in the head and lived. Only those parents whose infants lived for more than 1 week had the opportunity to participate in treatment decisions for their infants and realized that infants might die. And again, here is a quote for one mother who talks about her experience. Again, for the sake of time, I won't read them, but here's an opportunity. Please take a look at that. The next slide, please. Feeling intense emotions after death. Parents use such words as shocked to describe how they felt when their infants died. One mother who gave birth to a stillborn infant said, "This was the worst moment in my life, the worst moment in my life." Mothers described themselves as being very emotional and even feeling like they were going crazy. So please, again, here are the words on the screen of one mother and her experience of intense emotions after the loss of her infant. Next slide, please. So when we see dealing with stressful life events during pregnancy and around in the time of a loss, parents were dealing with stressful life events that were not all related to the loss, such as economic hardships, deaths of other close family members. And they express things as feeling abandoned and unsupported. They're feeling causes of stress. Some mothers argued with family members so intensely that they had to relocate. There were several mothers who explained that they were deserted by the father of the baby when they became pregnant. Several mothers felt abandoned by their own parents, separated from them because of substance abuse and or incarceration, and were not there during their pregnancy. One mother had the extra responsibility of raising her 3 younger siblings because of her mother's substance abuse. Next slide. And this story, this particular quote, I want to read because this was just, again, touched me so. She said that I was stressed out. I wasn't getting any rest. It was 8 long laboring hours. And when I would go to the clinic, they were like, "You are doing too much. You have to stop. You haven't given the baby enough rest." I didn't really say to them what I was going through. I had this job. It was the only way to support the kids and keep eating. The money I was getting from public aid was barely enough just to pay the rent. So it would be 2 or 3 days I went without eating, just drinking water and eating crackers. One of them days I felt the baby move. I said, "Oh, you are still surviving in there." Next slide. Other things that we saw was experiences of other illnesses or untimely deaths. Many mothers had close relatives who were seriously ill and were hospitalized. We had parents experience deaths of other close family members or friends. We also included untimely deaths of infants, nieces and nephews, siblings, parents, grandparents, and other young male cousins. And one father, a substitute high school teacher, experienced the deaths of 3 students in 1 year. Even if the death had not been recent, the current loss triggered painful memories of other deaths. Next slide. And so one of the big things that we saw in this looking at this literature was the receiving of unfair treatment. Parents perceived they received unfair medical treatment. One mother reported unfair treatment by a funeral director who buried her son sooner than she was told without her presence. According to the mother, the funeral director said that he did not know that she wanted to be present at the burial. She said, "I was mad with them because they buried my son without me being there. How did he not know I wanted to go? My heart just dropped. Like I didn't even get a chance to say goodbye to him." Next slide. Again, I take a moment to look at another quote, who's a mother whose baby died after being in neonatal intensive care. Again, here as she talks about her experience and how she had to deal with what she felt was that people really did not do the best that they could. I think it was because of my financial. I was on public aid, and so much of that certain doctors will only do so much for people on a Medicaid card. But if I had better insurance, they would have put their heart and soul into it. I feel they didn't. Next slide. And here's one father who says, "I know she," which is his wife, "was not in a private room and was not a VIP patient, but to me, she was a VIP patient." The father also perceived unfair treatment that with regards to paternity establishment, he shared his name and did not appear on his son's birth certificate, even though he provided the requested documentation that he was married to the mother of his son. Next slide. And so we go into looking at creating the cherished memories of their infants. And again, these are some of the things that came out. Parents, again, not unlike the general population, expressed the need to being physically close, observing family resemblance, collecting keepsakes for their infant, making decisions on infant burials, including the memorial and prayer service. Next slide. And so again, one mother recalled, "And I held him until about 4 hours. I said I loved him. I don't want him to go, but God knows best. Maybe I'm struggling so much that it would be just another burden, and he knows best. Well, I was just holding him and crying. I said, somewhere you get a chance to see your grandma. I tell him, when you get there, when you get old enough, you think about me. Next slide. Living with the loss was another big piece. And that is, again, encountering difficult situations, relying on spirituality, seeking diversions of support, making sense of loss, contemplating future pregnancies. And again, all things that we see in general grief as well, but maybe a little bit more complicated when we are looking at the lives of many of these women who were experiencing a lot of inequities. Next slide. So, how to help bereave African American families? And that is a big question. And even though research is limited, I was able to locate some information I would like to share around providing support. Next slide. And so, again, another resource. Even though this book came out in 2005, I have not found another one yet that is comprehensive as this. And it is called The African American Grief. And so when you look at African American grief, we need to look at it from the fact that it is and is not like white grief. There's other points that they brought up in the book: cultural grief and the pileup of losses, of group therapy and support for African Americans, African American diversity, and revising how we think about grief. Next slide. So when we look at African American grief is or is not like white grief, we need to be supportive and helpful to bereaved African American women and their families. We need to be attuned to the knowledgeable and be knowledgeable about racism in the United States and become broadly familiar with and knowledgeable about African American culture. Next slide. When we look at cultural grief and the pileup of losses, we need to explore the concept of cultural grief that goes beyond a death, recognizing and addressing that both past and present losses may contribute to the grieving process. Understand African Americans may be impacted by loss related to centuries of racism, discrimination, and oppression. Next. Group therapy and support for African Americans. The authors stated that counseling and support group facilitators need to be well-grounded in dealing with racism and discrimination in African American lives. Not being able to deal with sensitive issues could be unhelpful or even hurtful to grieving African Americans. It's important to be able to move beyond the rudimentary can't talk now, level in dealing with issues such as race, class, racism, discrimination, and related matters. And it could mean having to confront one's own complicity in racial systems and the way one benefits from that system. Next slide. When we look at African American diversity, we need to be knowledgeable and support African Americans who are grieving while always require attention to the uniqueness of the individual situation and community. And remember, African Americans different in social, class, religion, spirituality, cultural identification, and other ways. Next slide. And revise how we think about grief. It's important that our country, our communities be understood not as a homogeneous society, but a mixture of different cultures with many different ways of understanding and dealing with dying and death and grief. We must not assume that everyone shares a common culture when it comes to loss. Next slide. And always remember that one person's grief does not invalidate another person's grief. All losses is relevant. All loss is relevant and impactful. We must always keep hope alive. Next slide. So now I'd like to welcome my colleague. And again, in closing, I want to thank all of the people who have been responsible in helping me put together this particular presentation. I have Ms. Carla Coleman on the line, who serves as our communications director for Baby First Network, and will kind of, as much as we can, lead us in discussion and hopefully be able to respond to some of the questions that people might have put in the chat box. Ms. Coleman, are you there?
Yes, I am. Thank you, Stacy. Just from watching the chat box, there's a lot of people who are responding and saying this was a good, really needed presentation, and there's some great responses here. An excellent presentation, someone just put in the chat box. So, but there's also a lot of questions. And I know that we have 3 questions here that we were going to address, but would you like to address some of those questions from the chat box first?
That'll be great. And then we will work very hard. I know we can't get to them in the next 10 minutes, but we will work very hard to try to respond to them and put out some sort of document that can address some of the questions that you did present in the chat box. Okay, go ahead, Carl.
Okay, here's the first one. Do we see that African Americans rely more on spirituality to get through these challenging situations?
Yes, I have to say we do, but you know, I'm also guarded in that, because again, I mean, when you look at spirituality and religion, a lot of times that word is used interchangeably. And so, you know, I know a vast majority of African Americans do have religious beliefs, and that they do rely heavily on churches and other religious organizations to help them get through things.
Okay. Another is from Carolyn, and she asks, do you think African American families should have their own grief group led by an African American therapist, or should everyone from all cultures be integrated?
Well, I'm going to speak from experience on this one. In my work in Ohio, we had a family, African American family, who had lost an infant and was invited to a standard support group. Again, the majority, well, actually all members of the support group were white. When the group came, the African American family came, they came with their grandmother, the mother, the father, and an uncle. It was an extended family, at least 5 people from the family. And in their discussion around the grief and that stage of anger, one of the biggest concerns they had was how the police treated them when they came out and responded to their call when their baby had died of SIDS. And their whole conversation within that whole support group was around the anger and how they had been treated by the police. They hadn't even gotten to the point about grieving for the infant. Well, what I was told is that the facilitator at the end of the group said to the family, I don't know if if this group is really for you, because, you know, we are really concerned about infant loss and the fact that your experience is really angered about the police. You know, I don't know if we can help you. So here we have it. This family who took the leap to go out to this group has now been sent away. So what I say about that is that if you are going to have a diverse group, and if you don't have the opportunity to have an all African American group, that we again need to be very careful to understand the processes of grief that these families experience, and realize that the way their grief look might not be that of the general population. So we don't run into that kind of problem again.
Mm-hmm. Okay. The next question here is, how does the pre-existing trauma and loss due to slavery play a part in the newest epidemic, which is the COVID-19?
Oh man.
Yes, a deep question.
You would ask me that, McCollum. I would put that one out. You know, I think it's the same thing that we have said. I mean, again, the social determinants of health. I mean, you know, we, and I'm speaking we because I am African American, since slavery has always been second-class citizens. We have always had to play catch up. We're always at the end of the line. And so, again, we are seeing this, you know, in real time on how we are not being able to be tested. We have to experience the implicit bias of a healthcare system or possibly a physician who, again, discounts us and what our issues are. And so I just think that this is, again, looking at social justice, looking at the impact of racism, not explicit and implicit biases are all things that are derivative from 400 years and that has gone through the continuum up to where we are today.
Mm-hmm. And that maybe one or two more questions here, Stacy, and I'm going to take one from on the slide. And what are some of the barriers that prevent African American families from utilizing the limited bereavement support services that do exist?
I think one of them is that, again, the trust factor is probably a major piece. The other is that, again, many of those services, they don't see people there that look a lot like themselves. There's another study that's done around African American women that have experienced pregnancy loss, who actually are women on a higher economic level, which I didn't have enough time to include in this presentation, who talks about their experience of going to support groups or seeking services, and that they didn't feel that the counselor or the material really applied to what they were going to. And so I think that that's a lot. That reason why a lot of African Americans don't utilize those services.
Okay. And then one last question from the chat box, and then I think we can wrap up. Is it possible for white support systems to adequately support women who are Black?
Yes, I think it is. I think, but you really have to, again, take a long look at what their lives are, what they're going through, and be sensitive. You know, again, in this book, it talks about, you know, the privilege and things that, you know, many whites have, and you cannot look at bereavement from that lens. You really have to take an equity lens and do your research, and also be very honest to say that, you know, I might not fully understand what you're going through and your experiences, but I'm here to help the best way I can. And I think in many cases, honesty is the best policy, and that people can understand and appreciate. There's one story that talked about how the nurse basically held the hand of this African American mom who had lost her baby, and how significant that was to her, because she felt that that was truly from her heart and knew that she didn't have to do it. So I think that, yes, you can, but I think, again, you have to recognize that there is differences, there is inequities, and what that means to that particular mom.
Okay. All right, thank you, Stacy. Anything you need to share with the group? We have just a few more minutes left here, 5 minutes to be exact.
Well, yes, for sure. I just want to let everybody know that we are doing a short survey, and it's going to be entered into the chat box, and then also it will be coming to you in an email. And I really, really ask you, please, to fill it out. We're just trying to gather some more data. You know, one of the big questions, and if you see that the question here on the screen about how the financial support of bereavement services is really non-existent. And if we don't take it from a framework of mental health or substance abuse, we really are not able to support the need of women and families in general who have lost. And even in this day of COVID-19 and the amount of deaths, I am hoping that funders begin to understand that it's more beyond, again, well, bereavement is part of mental health, but to be able to be, you know, specific in finding ways that we can get money to provide support, as well as research these things on how we can be better equipped to provide support to people that are in need. So I ask you and beseech you to please complete this out, the survey. We're going to use this again to kind of support that argument that we do need more bereavement support, not only just in African-American communities, but in all diverse communities, all communities as we experience death.
Well, thank you everyone for participating in this webinar. I just want to remind you that the slides and the recording will be shared with everyone on the website. You can also go out to www.babyfirstnetwork.org, or you can go to www.NICHQ, NICHQ.org, or is it .com?
.org.
.org. Okay, good. I want to make sure I had that correct. So thanks again for joining us, and have a wonderful day.
Thank you all.